Hello everyone, and once again welcome to my channel. So today the question is the hair that has come out 2 weeks after the procedure, has the body rejected this hair? So that is the topic we're going to cover, and I'm going to shed light today on shedding, crusting and graft rejection. And do grafts that shed grow back or not? These are crucial topics that most patients worry about in the first few days after a hair transplant. So after a hair transplant is over, it is usual to see crusting. As you can see in the timeline journeys of several patients I have shown in the links above, this is how nature heals the body. And while this may not aesthetically look very pleasing, there is nothing to be worried about. It is just the ugly duckling phase. And I have covered this topic in this link. So what are crusts? Crusts are small scabs that form around the recipient area which has admitted a graft. These scabs or crusts develop as a part of the body's natural healing mechanism, as small amounts of blood that ooze out, plasma that accumulates over time, dries up on the scalp skin surface. And this also contains the circular cord part of the epidermis of the graft, which over time dries up, sloughs off and falls off as crust. So over a period of time, this entire crust, which is formed by the blood, the plasma and the epidermal skin, it desiccates, dries up and falls off. And most of the time it falls off with hair. And that's where everybody gets perturbed. So proper care after hair transplant, so that these crusts fall in due course of time and do not take much more time, giving enough time for infection to accumulate under them. There is a set protocol in every clinic to take these crusts off by 10 to 14 days. In my clinic also we have an elaborate procedure, a link to which you can click above. Basically follow the 3 dictums of antisepsis, hydration and chemical and mechanical decrusting. Within about 7 days to 10 days, these crusts that have accumulated begin to fall off. And the amount of crust that you have depends upon the size of the graft, depends upon the size of the punch, the size of the incision site, how traumatic it has been, whether you use CST blades, whether you use needles which don't have a guard, so the bleeding is much more than in those who use CST blades. So by the second week, most patients do not have any crusts left. They've all fallen off. However, if the crust persists beyond say 14 to 15 days after the hair transplant procedure, if the crust is still thick, the crust is not lifting off with the hair, it becomes important to contact your surgeon to rule out any infection or complications. One of the most common questions that I get from patients after hair transplant in the first week itself is, why am I losing my hair? This is in spite of the fact that the patients have been educated about the timeline of growth, about the timeline of the initial few days after a hair transplant. Still, when the hair falls off, the patient is perplexed, the patient is perturbed, and many times the patient panics. So this shedding refers to a phase, a temporary phase, when the transplanted hair fall off. Very alarming for those who have invested their emotions, their time, their money in a hair transplant. Seeing hair fall off is not a very easy thing to accept. But let me reassure you, all these hair, if planted correctly, will with time grow back. To understand why shedding happens, we have to take again a closer look at the hair growth cycle. The hair growth cycle essentially consists of 3 phases. The anagen phase of the hair cycle, when the hair is in full bloom, about 70 to 80% of the hair are in anagen phase. And then the catagen phase or the transitional phase, in which the anagen hair are beginning to deteriorate before they go into the telogen phase or the resting phase. And then the cycle starts afresh. When we perform a hair transplant, whether FUE hair transplant or FUT hair transplant, we are essentially moving hair from the donor area to the recipient area. During this period, these follicles, depending upon the technique, experience various grades of shock. And as a result, many hair, almost 60 to 70% of the hair on average, go into the telogen phase. And this shock-induced phase is also sometimes referred to as telogen effluvium. So within the first 1 to 8 weeks after hair transplant, it is normal, absolutely normal, for patients to experience shedding, some amount of shedding of the transplanted hair. Though these hairs have fallen off, it is important to understand that these hair shafts are not living. The living element, the life-sustaining element of a hair is the hair bulb, is the hair root, which lies under the skin, and you can't see it. It is alive and kicking and ready to grow a new hair which will appear on the skin surface not before 4 months. But at the time it will be wispy thin, will gather protein, become dense, and you get a result not before 6 months are over. And by the 12-month mark, the entire growth period is complete. So the key at this stage is to be patient and realize that this shedding phase is a temporary phase, and what is going to follow is going to be permanent. Now let's move on to the concern that understandably people have about hair which have fallen off, hair that have shed, whether the body has rejected these hairs or not. Does rejection happen after a hair transplant? Rejection after a hair transplant is very, very rare, but there are certain nuances that I'm going to explain just now. The long and short of it is that the body does not reject hair because of the simple reason that it is your own hair. It is autologous tissue. It is not like a renal transplant or a liver transplant that there are chances of rejection. The body does reject tissues which are taken from another individual. It does not reject its own tissue. And hair grafts are autologous tissue which are taken from the individual's own donor area, not from anyone else. So there is no chance that the immune system of the body is going to reject grafts which are autologous grafts. Now that said, while true rejection is rare, there can be instances in which the body throws out certain grafts and these hair fail to take root. But it is very important to remember that this is not rejection in the true sense of the term. The immune system is not playing a role in this mechanism. This is a situation in which the grafts have been rejected by the body because they have been implanted incorrectly. And now we discuss the 5 reasons. Number 1 is trauma. Grafts that have been handled incorrectly, grafts that have been out of the body for a longer period of time, grafts that have been implanted too shallow that they float or too deep that they sink. These are the grafts which may fail to take root. When you find a shed hair with the root which is kinked, it has a J-shaped curve, this root is not going to grow because when you plant the hair inside the hole, and if the hole is not long enough or you're pushing the graft too vigorously inside, the end of the graft is going to recoil and form an S-shaped or J-shaped curve, a kink. And this hair, this graft is not going to grow at all. And the same is the case with the graft which is coming out in one piece before 5 days are over. The cause could be trauma or a patient rubbing off his grafts. Secondly, infection. Though infection after hair transplant is rare, if proper antisepsis is maintained, if the operation theatre is sterilized, if due diligence is done during the procedure and during the aftercare. But rarely there are instances when infections do happen. And they happen due to several reasons. The infection could be picked up from the OT or the infection can develop at home. And this is going to harm the grafts. The most dangerous infection to happen is the infection by an organism, a bacteria known as beta hemolytic streptococcus, which just eats away the grafts. It does not let any graft survive. So therefore, the need to maintain proper hygiene in the operation theatre and at home after you go home after the hair transplant is over. And if post-surgery care is not followed, such as avoiding excessive touching, scratching the planted area, undergoing strenuous activities after the hair transplant, these grafts could get damaged, leading to less than ideal outcomes. Smoking or other factors that reduce the blood circulation in the planted area also impede the growth of the planted grafts. And lastly, diabetes. Everybody knows if the diabetes is uncontrolled, if the HbA1c level is above 6, a hair transplant should never be done. A lot of complications that you see, the blood sugar levels, the HbA1c level of the patient was not carried out. So to minimize the risk of graft failure, it is crucial for you to follow all post-operative instructions that you've been given. All instructions must be followed to the letter, keeping your scalp clean, avoiding any trauma, and above all, staying in close contact with the clinic. For any concerns, any problems that you may have are all key to successful hair transplant. Patience and proper care are key to getting the best results at this stage. Every individual heals at his own pace, but as long as you follow the recommended steps, if you're doing everything correctly, the likelihood of your getting an excellent result are very high. So that was the talk for the day. If you have any question about hair loss treatment for men and women, about hair transplant procedures, follow-up care, do let me know and I'll get back to you at the soonest. leave a comment in the comment section below, and don't forget to share the video with your family and friends. For those who haven't subscribed, please do. Your encouragement keeps the channel going. Have a nice day and God bless you.